Most Americans have pretty strong feelings about the US healthcare system, and for good reason. It's the most expensive in the world, and yet somehow all that money doesn't buy the best health outcomes. But if you're thinking, oh, I'll move abroad and it'll be this healthcare utopia, I've got news for you. I'm Darian, an American who moved to the Netherlands, and this is part 16 of 31 things Americans should consider when planning a move abroad. Today's topic is healthcare in another country. So, first, a common misconception. I've heard a lot of Americans say that healthcare is free in Europe, and it's significantly cheaper than the US, but most places are still requiring things like mandatory insurance, copays, or government contributions. In the Netherlands, for example, everyone is required to have health insurance, private health insurance. And while costs are lower, we still pay monthly premiums and copays. That said, there's a big difference in priorities when it comes to healthcare abroad. The floor is much higher. No one's crowdfunding insulin, going bankrupt over a broken arm, or dying due to excess of care. But the ceiling is also lower. If you're used to just seeing a specialist on demand and you move abroad, you may have some adjusting to do. For me, one of the best things about healthcare abroad is that my insurance actually covers anything my doctor deems necessary. No prior authorizations, no 5-hour calls with billing departments, no surprise bills arriving 6 months later. To say it's refreshing is an understatement. But preventative care here is less of a thing. They don't do annual checkups or routine blood work. There are fewer vaccines. We have to fight for flu shots. Chickenpox vaccines for kids are not routine. The shingles vaccine is not covered by insurance. And they also do fewer cancer screenings. I had annual checks in the US because I've had a basal cell carcinoma, but here I can't get that. I can hear the Dutch people running to the comments right now. So let me say this. Every healthcare system has trade offs, but the challenge isn't just the system itself, it's knowing how to navigate it. In the US, with all its flaws, a lot of Americans have learned to work that system. We know when to push for a referral, how to argue with insurance, what to expect in terms of care. When you move countries, you have to learn all that all over again. If you need an urgent specialist appointment, you might have to fight for it. If you don't speak the language, it can make describing your symptoms extra challenging. And of course, navigating a pandemic during all this was extra special. If you're a mid career professional with kids and you find yourself suddenly dealing with a health issue, navigating a new system can be really overwhelming for a while. Every week, I see other immigrants asking online for advice because it takes time and networking to figure these things out, and they're reaching out to the only network they know. And Dutch healthcare is considered one of the best in the world, but no system's perfect. You just have to choose what challenges you're comfortable for. And when you move, be prepared for some frustration. I hope I'll see you tomorrow for part 17.